We have to make sure that the politicians are held accountable.
Every administration had the ability to put a ban on asbestos.
When it comes to asbestos, it really is about power, money, and politics.
So I'm going to introduce our next speaker, Dr. Firefighter Pat Morrison. And, you know, you always have to, everyone understands, you know, just by law, you know, firefighters are up here. They're on the pedestal. And, you know, people try to say, hey, well, you're a doctor, you help people, this or that. But you know what? My own butt is not on the line. When I'm operating on someone, it's their butt that's on the line, not mine. These guys, when we're running out of a building, they're running into it. So we can't have enough respect for the firefighters. And here's
Thank you. Good morning, everyone. I'd like to start just by thanking Linda and ADAO for all your work you've done. I've known you for a long time. I think Alan brought the warm weather for us today. Those traveling in from out, this has not been the weather that we've had here for the last 2 months, so I appreciate that. And all the speakers. My son's sort of an amateur comedian, but he would say that Dr. Flores murdered in his presentation, is what he would say. Which, yeah, from what I know now, that's a compliment. So anyway, and you know, for all the people that that did speak and all the information, I get something from everybody that spoke this morning, and especially those interns out there that you're working, and hopefully that we have those new advocates. Hopefully that we have those people that are going to be interested carry this message and to be the really the new generation of challenging, and because it's you're in a small minority, you're not in a big place, but you have to have that passion, and that passion is what really changes the world. You know, without it, as they say, you know, democracy will die in darkness, and we really do need the young people to really get involved and to get engaged and to realize that you can make a difference. You can make a difference. So what I'd like to do is just start, never back down. It's sort of a term that we use in the fire service. We don't back down when we have an event. 9/11, when we lost 343, they didn't back down. You saw them walking up the staircase, knowing that in a lot of cases that this was probably going to be maybe perhaps their last call. But we really use Never Back Down for the organization that I'm part of. I'm part of the International Association of Firefighters. We represent 310,000 firefighters across the US and Canada, FDNY, all the way across to California. And for us, Never Back Down means we're going to protect them no matter what it takes to make sure that they have a voice in the health and safety. So I'm going to use that theme here a little bit this morning, but really for us, it's that firefighter term that you're going to go into battle. And I really do think that this is what you do here. You're going into battle, and there's a lot of reasons you're going into battle. And there's a lot of reasons that people don't want to see you here, don't want to see you around, and definitely don't want you to be a part of this. Because I think it was well stated earlier, there's a lot of money to be gained on the other end. Thank you. Thank you. It has. It's been, the last 8 months have been, I was a career firefighter for Fairfax County Fire and Rescue. It's just right across the river. I have 3 brothers that are firefighters. My dad was a cop in Lawrence, Mass, came down when the CIA opened up, and when he was a cop, he wasn't a firefighter. We just told him that he wasn't smart enough to pass the entrance test for the fire service. So I just kind of want to go through, a couple things here that happened. I'm not going to talk about all these events, but literally the last 8 months we've been on the road. And what we do is we try to get out there ahead of a storm, after the storm, or after the event. The first one there is just the Charlottesville event. That was the shooting that took place. In the fire service right now, we're dealing with a lot of behavioral health issues also, and this is one of our two key points here that I just want to say for our occupation: cancer and behavioral health. Those are the 2 main areas that we're actually battling with now. A lot of it is because of stigma, a lot of it is because the services just aren't there. The second one, if you go across, we got to Harvey. Harvey was a huge event. It was a flood event. We had a lot of our members that didn't lose their houses, but the houses were flooded. It was somewhat like Katrina when we were down there. But you had to come in and you had to gut out right away as quickly as possible to get that drywall, to get the insulation, to get that all so it's dried. And nobody takes the time. I can tell you right now, nobody takes the time to check whether they have asbestos or not. They're so concerned about what that issue is. And unless you do a pre-plan, when you're in the middle of the disaster or after disaster, you just do not have the capability. You're worried about other things that take place. We came back and we went to Irma down in Florida, and Florida was another event in the Keys, and the same thing over and over again. We had workers that were out coming down. We actually had a group of FDNY firefighters, Heart 9/11. They actually come down, they help us with demos and houses and to do everything possible. Just going back to Harvey, what we had to do too was we had all those firefighters that didn't have any Hep A or Hep B vaccinations. They're sitting in contaminated water. We immediately had to vaccinate that whole population down there in Houston, the Texas firefighters. The shootings it's not really part of this talk, but I've done this for a while, and from the Clark County shootings that took place, was pretty hard to go, was pretty hard to attend. And then in the middle there, you see the plane going across. We just can't get ahead of our wildland fires. We're just losing, California, it's not it used to be a season, now it's just almost a monthly event out there. And then the last one was the Parkland shooting. So I just wanted to kind of give you, this is in our world, this is what's been going on, and we're still dealing with past events, and I'll bring up some of those events also. We do know that what we do is, for the fire service, and this is, these are some major events, but every day right now, a firefighter is in somebody's kitchen pulling down ceiling because there was a fire in there, and they have to pull it down, they have to get the hose lines in, they have to make sure that fire didn't extend. Every day it is. You'll have firefighters that will be coming out of those buildings just covered with asbestos. On that. And then, they do have, the respiratory protection, but what we're actually finding out is that sort of contamination control that we have is spreading all the way back from the firefighter after the fire into the fire apparatus, back into the firehouse, and then even back into the home. So you have to almost have a timeline of that. And we're trying to do a lot of different programs. We're trying to design firehouses differently. We're trying to understand its prevention, its education. It was stated here earlier that at 9/11, all those workers down there, not only the firefighters, the trades were just incredible. The miracle of 9/11, if you were down, if there is such thing as a miracle, is that nobody was killed during the cleanup, nobody was killed during the rescue and recovery. That was just, if you were at the site, and we were down there for a couple of months, it was just these men and women that protected us and tried to help us to get those remains were just an amazing group of individuals, and they got exposed. We get a lot of, because of the word firefighter, we get a lot of attention, but there were a lot of heroes behind those scenes that really took all of that debris and did all of that. Sometimes the sanitation worker is not necessarily that one that everybody thinks about right away, but I can tell you, when Hurricane Sandy hit New York, the #1 communities they love, sanitation workers, get this out. But when I say that, were they protected? What was in those piles? What did they do? They just lifted it up, took it out. We don't even know how many exposures took place. So we did have, after 9/11, we had that attack. And during that attack, what actually took place was when we were there, we were trying to get information out to the firefighters because they were really concerned what's going on down there. Our gear is not made to do what we did for week after week. It's just not. Our gear is thermal protection. We go in, we have thermal, we have an SCBA. To do rescue and recovery, this was a situation that was not normal to the fire service. So the amount of respiratory protection was lacking, and we could have protected, and even the rescue workers coming in. I remember a friend of mine who went down there to volunteer. He went in a line, and they were handing out respirators, and the individual said, "Do you want the good one?" And he just said, "Yeah, I want the good one. What the hell? I don't even know what the bad one is." But people just weren't wearing that. You know, they weren't doing that. They weren't taking care of themselves. So the hurricanes that we just had, we have the season coming up. We just know the exposures that take place in the communities, and it takes place with the firefighters. I'm just going to say it right now. The International Association of Firefighters, we just want a complete ban on asbestos. That's it. There's no safe level. There's nothing. There's not even an argument, for this. I mean, that's just what it is. And I'm really proud of the Canadian government up there for doing what I consider the next right thing. And hopefully, we are working with the Canadian firefighters. We've been on several meetings with them about asbestos awareness prevention and what we have to get out there too. And it's, this word, and you'll hear it, and it's the legacy. It's not a legacy death, it's a real death. Asbestos is just asbestos, and we're going to continue to battle with that. We did a study, and I just want to kind of go through, and we were late to the game. We were part of maybe not so aware of this, and NIOSH, and I really dealt with Dr. Hales from NIOSH, and I told him we had this long-running argument about what was the chief cause of death for firefighters. On the fire ground, it's still heart attacks, sudden cardiac arrest on the fire ground. But I said to him, listen, when I retired from Fairfax County and went to the International, I run the health and safety program there, and I kept seeing just these cancer deaths. I mean, these cancer deaths. And why would I be seeing them? Well, we have what was called cancer presumption. Cancer presumption in some states means it doesn't give you the protection, but it puts the burden of proof on the employer if you have the presumption and you have a certain cancer that has been related from studies to the fire service. That burden of proof is huge. And when you're looking at workers' comp, you're looking at the compensation, you're looking at long-term care. So NIOSH actually did a study. They went, for us, they went out of their way to study 30,000 firefighters, and we looked at San Francisco, Chicago, and Philly. And with that, what we had to do is, it was retro. They went back and they looked at death certificates. And it wasn't until we really took a look at those death certificates that we realized how many cancers that we had. And it was the one cancer that surprised me, kind of shocked me in some ways, is right there is that list, and that's mesothelioma. I mean, it came out like for us all of a sudden. And I said to Dr. Hales and the NIOSH team, I said, what rate is that? And he said, right now you guys have 2 times the rate of the general population. And I said, we haven't even, we really haven't had those numbers coming across the desk, and it's just the latency factor. That's what it is. We have firefighters that come in normally at a younger age, and they're retiring, and when we went back and looked at death certificates, this came up, and we went, oh my God, this is something that we have to do. We have to address this. We have to be more proactive. We got to get out there and really let people know. We've done several dust studies, and the dust study, it's not as, it doesn't sound as scientific as I'm going to state, but we actually went into firehouses in California, and we've done it in Canada, and we've looked at the dust in the vacuum cleaner bags, from those firehouses, and we just wanted to analyze that. What was in those bags? What were we taking back? And it was amazing, the amount of asbestos, the amount of flame retardants, the amount of other carcinogens that we were taking from chemicals from the fire ground and putting them in there. But I just give you that chart just to kind of take a look at. That's for us, this is something that kind of jumped at us, and we have to do a better job. We're doing. Unfortunately, this is something that I have to do every year. It's the Fallen Firefighter Memorial. This is out in Colorado Springs. We have over 7,000 names on this wall of firefighters that have died in the line of duty. And those firefighters were the only major international association that recognizes cancer, certain cancers, as an occupational line of duty. Everybody else doesn't want to recognize that for a number of reasons. It's just too hard to deal with, but we do. This year we're going to put 285 names on the wall in September. 60% of those names, those firefighters have died from occupational related diseases, and cancer being the chief cause of that. So this is something that has really given us, sort of the push and the drive to really make sure that we're doing a better job. Again, the only way I can prevent somebody from being on that wall, especially in the cancer, is I got to go back, and it's that prevention, it's that training, it's that education. But the real thing that we're really trying to do is that early screening that we have. And for the fire service, this is something else that's being missed, is we know we have certain cancers, but can we go back and can we do early screening to identify those? Do we have the capability to do that? Never back down. I just kind of want to go through a couple of this. I mean, you see the EPA. At 9/11, we had the Secretary of EPA telling us, that all the levels at 9/11 were safe. Actually came out. Actually, I remember writing a newsletter. We were going out to the fire stations. So they wanted, what do they want after an event? I mean, it was a huge behavioral health event for some people because of what happened. They just wanted information. They really wanted to know what the hell was down it. What did we expose ourselves? I know we're sucking this stuff in. If you walked by anybody, you knew exactly, that they were there at 9/11. It was just, it had its own smell that, I think for some of us, it will never go away. But what was told was that it was the safe levels. Why was it told at the safe levels? A, because they didn't want panic. They wanted to get that debris out of that site as soon as possible, get it over to the fresh kill landfill, and make sure that everything was working its way towards a cleanup, a quick cleanup, getting order back into a chaotic situation. So they lied. I mean, that was it. So they lied. The other one up there is the Israeli chemical company. I don't want to go into a lot of this, but I think that, I have to mention, we're fighting with I didn't think I'd be fighting with the chemical company and flame retardants. You would think that we would be, the International Association of Firefighters would be all for flame retardants. What we found out, again, was that flame retardants, you're sitting on them right now. It's brominated, most likely brominated deca. Don't worry, you're probably all right for right now. But, this brominated deca, again, is something that was put in, and this started back in the 70s. And I'll just give you a real brief history on this. In the 70s, the tobacco industry was faced with a lot of people coming after them to put together or to design a safe cigarette. Safe cigarette was that we had a lot of individuals that were dying from smoldering fires. Cigarette, you fall asleep, you're drinking, the cigarette goes into the sofa and it ignites the sofa and the individuals die. So the safe cigarette was just a way that if you weren't dragging on that cigarette or taking puffs, that it would go out, self-extinguish, and the ignition source would diminish and perhaps, not in all cases, but would prevent a fire. So the tobacco industry did an unbelievable job. They created the National Association of State Fire Marshals. It's incredible. It sounds like a credible agency. It is today, but back then it was formed by the tobacco industry. And they actually did it because they said it's not the cigarette, it's the furniture. So what we have to do is we have to put flame retardants in the foam that you're sitting on. And if we protect that, then the fires will go out. And that's actually took place. That took place in the 70s, 80s, and the 90s. And we are at a major battle with them. We're fighting with them, and we realize that they use the fire service and Dr. Flores, I think you said it earlier. It was called the merchant of doubt. If you can put doubt in a consumer's mind, just a little bit of doubt that if you have this product, you're going to be safer than without it. The tobacco legacy and their whole files was they put doubt in the mind that, well, it really didn't cause that cancer. There was that doubt in that. And that's what's being taken place today with that. So we're still battling with them. 3M they just lost a major lawsuit with pearl acids. It's the acids that it's almost the protective coating in your. It's like Teflon that's on that, but it was used for water resistance. And we had these chemicals being used for fire gear that we're actually right now being exposed to. And with that, we're fluorooctanic acids. It's called the PFOs and the PFOSs. But anyway, what we're looking at, that's going to be our next battle, and we can't back down from this industry. Just going back up to the Israeli chemical, and it wasn't just them, there were several other chemical companies. But what they wanted us to do is that they wanted us to go away. They wanted us to back down. They wanted us to say, hey, listen, this is not your fight. What they had that we didn't have, and I testified, I can't tell you how many states I testified in, and they would always come up after me and saying that firefighter cancer is really not coming from any kind of toxic substance in there. It's more of a lifestyle. It's more that they have to do a better job in training and protection on that. It all came down to money. This was the money. They had millions of dollars. They were pumping in, lobbying, bringing the lobbyists and money into all these areas, and we had to go from state to state to state to try to beat them. NFPA, we just had this is our National Fire Protection Agency. We just had a huge win that we're able to, with the industry at the table, trying to get flame retardants back into furniture, because what we've agreed upon, we have a big SOFA Act, it's called right now, is to remove that and to use what we call a barrier method where you can get rid of all the flame retardants. We don't need flame retardants. You don't need it in your furniture, you don't need it in places where they put it in there. But NFPA had put together industry, and we were able to win. You know, sometimes and we're a small voice in this big, huge industry, but we're able to win. But you can't celebrate because there's another angle that they're going to be coming at. And I kind of give you this information just to kind of, you know, for me, this organization, ADAO, is one of those organizations that has come up, and they're not going to back down from anything. They're not afraid. I mean, it's amazing when, you know, I do, you know, get a call from Linda on occasions, and just testifying with her at EPA and talking with her, and her tenacity of just plain talk. There's not a lot of filler. It's just plain talk. It's just being an advocate for the right reasons. This is, you know, to me, you have legislation, and this is where we're coming at, and this is really where, you know, we're all in this room together, and if it's not about politics, then you're in the wrong room, you know. This is about politics. This is about money. This is about power, and this is what it is. And the Toxic Substance Control Act that just recently came out, and EPA is running that, and you know, elections do have consequences and what's going to happen, but we're looking at the top 10 chemicals. We were able to get some flame retardants in that. But what I want to say here, and asbestos is the one that they're looking at right now. They're looking at it very, very hard, but they refuse to look at the legacy aspect of that. Everything I've talked to you about, from 9/11 to the hurricanes to the everyday fire, we are exposed to asbestos on a regular basis. And it's not legacy, it's asbestos, it's real, it's there, it's in front of us. It's going to be there for a while, we have to do that. But the Toxic Substance Control Act, I think, does two things, and we really have to hold the EPA to their feet to the fire here. What we've done, we've got about 85,000 chemicals that were grandfathered in. We're never going to be able to do anything about that. 85,000. New chemicals coming in now have to go through a health risk assessment. Can you imagine that? They have to, a new chemical that somebody's going to make or wants to make the next millionaire, you know, among these companies, is that they have to go through a health risk appraisal. And that health risk, hopefully, I mean, you have people that are developing chemicals here today that don't really care about that. You know, they work for a company, they don't care about that. That's not their, you know, their job is that they have, they have to make sure their company makes a profit, their shareholders are showing a profit, and they can't do, you know, let's don't get into that health risk assessment because that could be lawsuits, that could be something. We'll deal with that, we'll punt that and do that down the road. But this is the first time that we're going to be able to take a look at new chemicals and really take a risk assessment. I'm hoping. I don't know if it's going to work. I mean, a lot of us are just kind of crossing our fingers. I mean, this was a long battle. We did not like what they ended up doing, but you know, you have what you have, and we have to deal with that, and we will deal with that. But that's huge. That's at a federal level. that we are battling right now at this, and you have to have so many voices at the table. You have to be able to not only talk about why it affects you, but you have to be able to talk about what needs to get done and when does it need to get done. And we really need to do that, and that has to be a group. Not just the firefighters, not just ADAO, but there are so many groups out there, environmentalist groups and other groups that are really helping us, other labor organizations that are really working with us. That's at the federal level. I want to say here, this is the state level. And I just want to say for us, that's where it's happening right now, is at the state level. And you can have a federal bill. You can get something passed. I'll give you an example. The residential sprinklers, we passed it. We passed a national bill for sprinklers in buildings. Everybody, and that group, there was a group, it was a coalition, it was fire groups, everybody else. They actually came out, they were popping the cork on the champagne and celebrating it. We're going to have residential sprinklers put into all new buildings that are being built, all new houses being built. And we know that residential, I don't think we have a documented death in a house that has had sprinklers in it. We know it works. And it's about, again, it's about money. I don't want to get into those details, but it is about money. Well, what happened? That bill got passed, and then in every state that it went out, it failed. So the state has the power over the federal power on that, and the state then said, no, we're not passing that in our building ordinances. In one place, in Texas, they actually outlawed it. So the real battle, and they say this in a lot of cases, the real battle for us, and especially for asbestos right now, is going to be at that state level in some cases. This was a bill that is going around right now, and it is, I called Linda up, or I didn't call her up, I sent her an email, and I said, Linda, this is a bill, what do you think about this? And I love her emails back. It's not a lot of, there's not a lot of chit chat on here. And she just sends back, it is terrible, industry bill, don't support, Linda. That's all. That's all I really needed on that. And then, when she was looking at that and what we're looking at that, and we're looking at who actually is sponsoring that, you have ALEC, and I don't know if those know ALEC, but the American Legislative Exchange Council. That's just a front for, to kill unions, to kill pensions, that's all they do. They go from state to state to state. And the Chamber of Commerce. Those are the two that are running this bill here for it. We did not support this bill. We actually have, well, thank you, yeah. Although unfortunately it did pass the House, it's in the Senate right now. But what it gives us, it gave us, sort of that understanding that this is our battle. For the fire service, where we battle is at that state level sometimes. We have to get into that legislation. We have to get into those people. We have to get in. Tip O'Neill said all politics is local, and what he actually meant was that in your community, your risk is at that community, and you have to watch out for that risk. This is what they want us to do. This is it. This is quite simple. They want us to back down. They want you to disband. They want you to give up. They don't want you to question your efforts and run out of resources. That's what they want to do. That's how they operate, and that's how they will operate. In 2004, there was a small select group of people. I met Alan, it was Linda, little Emily was running around here back and forth. And what I see today, what I heard today from an extraordinary panel of individuals that are strong advocates is that it is growing, and it is growing in a way that we can't back down. Somebody told me a long time ago, I can go back in my past, but don't stare. Get the hell out of there. Today is today. Today is the present. Today is the fight that we have. We have to recognize that. We have to educate not only ourselves, but we have to educate those that we represent. We have to educate for those policy changes. We have to make sure that the politicians are held accountable for their votes. Why are they voting? Why are they doing this to a certain population? And if we don't do that, then we do need to just go away. But we're not. This is what we have. This is the choice that we've made as people that are really involved in this, is that we're not going to back down. We're going to take this information from the Marys The two presentations, Courtney and John, thank you so much for being here today. You know, you represented, you know, your families so well, and having that and hearing that from me, you know, it just gives me charge to make sure that we're doing the next right thing, not just for the fire service. This is the right thing to do for all of everybody living in this country and living around the world. So listen, thank you for giving me the time to share a little bit of our experience, strength, and hope that we're going to have a better world into the future. Thank you.
We have 5 minutes for questions and answers. Or comments?
Well, if I could take a moment, thank you, Pat, for a great speech. One of the big breakthroughs for the IAFF in my home province of Manitoba in Canada was a breakthrough about the pre-existing condition diagnosis issue that a number of speakers have raised. The problem that when a firefighter went to get workers' compensation for some type of cancer, the first question, as somebody said, well, you're a smoker, were you ever a smoker? You know, it's that type of question. The breakthrough was the legislation is now a firefighter can be presumed to have been poisoned at work. Is there any kind of a movement for that? I can't remember the term they use, but that type of clause or legislation so that workers can, you know, have a fighting chance to get compensation without having to prove exactly, specifically where they were, you know, ran into.
Yeah, it's cancer presumption, and the presumption is that, you know, that your job, it had these exposures, you were exposed to it, so you do get that cover. Just to back up a little bit, and thank you, Patrick. Our Canadian brothers and sisters up there are doing an amazing job. We have one member up there that actually sits on the IARC. He's the only non-residential. Alec has actually been invited to sit on that panel. But the one question I kind of even want to go back to the Missouri, were those states that don't have that presumption. On that asbestos bill that Linda was talking about, when we went back, we looked at that. If a firefighter was exposed to asbestos at that fire, he had to document that within 30 days. 30 days of that. That was that window that you had. And when I looked at that, I was shocked. I was like, what? It was 30 days. This is a bill that's going around because they don't have the funding, they don't have the trust, but then they were blocking us out. There's no way in hell that we would know what the hell was there. What we want to do, and especially with the legacy and EPA and what we're telling them, and we tell them, listen, we're not in a controlled environment. We have to go. We have to respond. We don't know what we're being faced with. So what we do want to know that if we can get the legacy within that structure, that firefighters know that there are dangerous chemicals. It's the same thing we do for some other things that we know are dangerous if we're going to respond to a building. We want the information ahead of time. We want people in those houses to know ahead of time. You want to make sure that that information is out. Abatement is the number one, I guess, is the gold standard that you could do. But if we don't get it, we at least want to make sure that people are aware. People aren't aware. John wasn't aware when he was playing, in that basement. And that's what's happening today, that we have so many people that we don't have names to yet, and they are going to be there in the future. But that's what scares me right now. Listen, thank you. Yes, Arthur.
Arthur?
Yeah, Patrick, thank you for that wonderful talk, and Roger for yours earlier. I do some work with firefighters in Philadelphia. We have a pretty good cancer presumption bill in Pennsylvania. Nevertheless, the city keeps fighting pretty much every case. You have to jump through all kinds of hoops to get compensation. And in other situations, I had a particular case that still rankles 15 years later, down in Texas, where we had a firefighter in his 40s, young man, non-smoker, 2 small kids, and we had to fight and lost a case of lung cancer in a firefighter for which there were no other known exposures other than his fighting fires with the PAHs and the asbestos and all the other stuff, the diesel. And you hear about, every shift, the trucks have to be tested, the equipment has to be tested. In winter in a cold city like Philly, the doors are down and diesel smoke is out there. And the argument there was, well, the union in that case didn't want to help the firefighter because they wanted better relations with the city to get a pay raise. Maybe you could comment on that, and there must be wide geographic variation as we see now with the bill in Missouri.
Yeah, thanks, Arthur. I mean, we're getting, our job right now is we have 35 states that have cancer presumption. Those are 35 states that really accept those cancers that we can document that have that research base. We know that we can get that. We do have cities, and we try to, our affiliate leaders, those are the labor leaders. We have 3,100 affiliates. Those are unions. In New York City, we have two. We have 854 and 94, firefighters and officers. And our job is to really educate them on why this benefit is here. What I have to do, and a lot of times I have people, when I testify for this, I'm sitting here and I'm being cross-examined, and it's like, we want this presumption because it's a gift and we shouldn't have it. And I have to tell those people, and I tell the firefighter, I even met a firefighter today that was dying from cancer that said, yeah, I'm great. The presumption is what they want. They don't want the cancer. They don't want that. For us, we have to go back and look at our exposures. We're doing a much better job than what we have been doing in the past. But we have to advocate, educate, and train our leaders to make sure that they understand and recognize that if a firefighter does succumb to a cancer, that if it's job related, that the presumption is more important than any pay raise at all for anybody in that department there too. For most part, I would say that's not the norm. That's not the norm on that there too. So.
Can I ask one question? So I know that
yes, Angel, meek, talker.
I know that you were at a meeting just a couple of weeks ago at EPA, and Linda and I talked, and it was like, my God, Pat Morrison is going to be at EPA. That's so huge. So I'm just wondering, when you talked about legacy asbestos with EPA, like what was the look on their face or their response to you?
Well, thank you. Thank you for those comments. I'm just a pissant is what I am. So, there are a lot of people here that are really the true leaders, and there are a lot of heroes in this room here for me. But I think EPA right now, given the current structure, I'm a little bit optimistic. Maybe I shouldn't be this optimistic, but when Linda sent out both C-SPANs in the House and the Senate, Pruitt, and they really hit him. They were peppering. Those legislators were really had the information they needed to go against Pruitt, and actually said about the legacy. You could see there was a pause there. There was a little bit of a pause. There was a little bit of somebody is trying to get to him. I don't know if we're going to get to him or not. I would imagine that once you think you can get to somebody, once the lobbyists come into town, once the money comes into town, just trace the money. I mean, Jesus, if this was the right thing to do, we would do it. But this is just about dollars and cents. Normally that's what I fight with, is dollars and cents. They want this pot if I'm not in there fighting. And if we're not part of this, that means there's more money in the pot. If there's not a trust fund, there's more money for the company. It really is. It's unfortunate. That's just the way this world works. And that's what we're faced with there. That meeting I thought was interesting. You never know. You have to take a meeting. Sometimes you have meetings where they really kind of pump you up and they make you feel like they're really listening, and then the decision has already been made. Whether that decision was made, I'm not sure whether it was made or not. But we wanted EPA to really understand that this legacy has to be addressed, that you can't do that. So we're going to be spending some political capital in the next couple of weeks to make sure that this is addressed, that the comments get in, and the firefighter's voice is at least heard in some cases. So anyway, listen, thank you again. I appreciate it.